Let's get through some particular problems. For example, abdominal pain. Notify the GP immediately. Direct patient to ED if asked to do so by the GP or if no GP present. How come you might be in a situation that you will have to make a decision by yourself and GP is not present? Well, when GP is left and you're closing up the practice and the patient suddenly appears on the doorstep. Assist patient to sit or lie in the most comfortable position. Give kneel by mouth, so no water, no food, no coffee, definitely. Stay with patient until help arrives. Refer if necessary to severe pain chart, collapse, semi-conscious chart. If any of the following symptoms present, instruct patient to call ambulance via 000. Gasping for breath at rest. Leg numb, cold and pale. Or legs numb, cold and pale. Sorry. Cool, clammy or lightheaded. Sudden back pain without injury. If any of the following symptoms present, direct patient to ED. Doubled over in pain, abdomen swollen and tense. Passing or vomiting blood, continuous pain for over 4 hours. Localized pain that is worsening. If none of the symptoms present, patient appointment can be made. Category 6. If severe pain, consider Category 5. Don't hesitate to upgrade category. If in doubt, and you think, it may be Category 5 or 6, consider 5. Eye infections or ear pain. Make an appointment today, if possible, or within 24 hours. Inform the GP, discuss with nurse if available. Tell the patient to call back if they get worse. Refer, if applicable, to unwell child or severe pain child. Eye problems or earache. If any of the following symptoms, direct patient to ED. Foreign body in the eye with loss of vision. Associated history of head injury. If any of the following symptoms, instruct patient to come to the surgery now. I'll list it for you. Foreign body in the eye without loss of vision. Earache persistent for longer than 72 hours despite home treatment measures. Foreign body in the ear despite attempts to remove. Severe unrelieved pain. If none of these symptoms present, make appointment today or within 24 hours. Underdose. You need to find out what kind of medication was underdosed. Check patient record to confirm dosage. If any of the following symptoms present, instruct patient to call ambulance via 000. Patient cold, clammy or lightheaded. Consult MIMS and or GP for recommended action. I'd rather consult GP. If no significant symptoms or danger identified, give patient interim care instructions. For example, if contraceptive pill, then advise regarding use of other forms of contraception. I do not exactly agree with giving advice over the phone, but nurse, and this is for the nurse, but nurse can do it when patient is present at the practice. We're back to triage for practice staff. Discuss with GP or nurse as soon as possible. Call ambulance or direct to ED if requested by GP or if no GP present. Assist to sit, lie in most comfortable position. Refer if necessary to severe pain chart. Do not give patient food or drink. Monitor for altered level of consciousness. Practice staff. Vomiting or diarrhea persistent. Advise to come to surgery now, today. Inform the GP. Take the patient to the treatment room. Put on gloves. Remember, personal protective equipment. We're dealing with biohazard here, vomiting and diarrhea. Refer, if applicable, to unwell child chat, pregnancy. From the previous slides, you could see that there are certain possible outcomes of any decision. It's either dial 000 or go to ED or discuss with GP or nurse, and then discuss with GP or nurse within 30 minutes, come to the surgery now, or appointment can be made within 24 hours, but preferably today. Okay, what risk management strategies we can employ here? First of all, if any situation that you think was difficult or unpleasant or caused some concerns, please report to your manager, report to doctor on duty. Document everything in patient's file. Discuss possible outcomes. What you need to document in patient's file is problem, duration, other symptoms, advice given, action taken. Let's do some role play. Role play number 1. A parent rings regarding their child who has a rash that has just appeared. The child has no other symptoms. The caller feels they need an urgent appointment. Let us refer to prioritization of patients guide. You can see that rash acute is categorized as category 5. No other symptoms persist. Let's have a look. Maybe there is some reference to child in other categories. No. Extremely anxious parent or carer with extreme concern. Maybe. Or maybe 5. So 4 or 5. 4 or 5. So what would be your answer? Role play number 2. An elderly patient calls the surgery concerned that they may have accidentally taken twice the prescribed dose of their blood pressure medication. They have no other symptoms at present. Let us refer to the chart again. So elderly patient took extra dose of medication. Anything here? No. Anything here? Anything here? No. Poisoning and overdose. So category 3. What do? Discuss with GP or nurse now. Another role play. A 72 years old male patient presents to the surgery complaining of chest pain which developed as he was waiting in the pharmacy next door. Again, we're referring to a chart. This chart is located next to every telephone set at the practice, at the reception desk. Chest pain, acute chest pain. That's category 1. Call ambulance. Alert GP immediately. So call ambulance refers to situation if patient was at home or still at the pharmacy. But if patient is here at the practice, alert GP immediately. Role play number 4. A patient waiting to see the doctor collapsed to the floor and commenced fitting. Again, referring to a chart, this patient will be in category 1, fitting. What do? Alert GP immediately. Interrupt GP immediately. A patient calls the surgery for a second time wanting to see a doctor about a persistent, severe headaches. So patient called twice about severe, persistent headache. Let's refer to chart again. Anything here? No, there was no injury, just headache. Okay. Here we go. Severe pain, including headache. Category 3. My answer would be category 3. Discuss with GP or nurse now. We now completed triage training. It was a refresher course for accreditation. Thank you very much for your attention. Till next time, goodbye.